I want to start by thanking you all for inviting me. And if you have any complaints after I finish my speech, please address them to Professor Latouf, who suggested me to be invited. He is the culprit, not me. I noticed on the excellent program that you have produced that I'm the only non-doctor whose name is with the title doctor. I am not a medical doctor, and I apologize for not being part of your great profession. Therefore, I would like you to listen to me as a generalist and not as an expert on the subject. I always call myself, as Dr. Omar mentioned in introducing me, that I'm a knowledge worker, I'm a student, and I would like to be judged on what I'm going to say from that perspective. Now, this is not the first global crisis, epidemic. Europe should have learned since the plague, which took over half of the population of Europe, that something has to be done for the future. And similarly, the whole world. I would like to focus on a number of points, which are lessons learned and to be learned. One, this crisis demonstrated the failure of our global system. We were very ambitious at the end of World War II in developing a world of order and a world order. And we did establish a number of organizations, one of which is the WHO, World Health Organization. But the fact that for the last few years, there has been calculated destruction of the world global system, which resulted in a reverse direction in globalization. Globalization is in its last times and days and years. It's over now. When the leader of a state says, my country first, then everybody would say, my country first. And that's the end of globalization, because I am destroying the first principle of all the organizations which were created to assist us in managing the globe. So the first thing that became evident is that the world order in its entirety has collapsed. When every country decides to close its borders and say, my people, I am responsible only for my people. And therefore, I don't care what happens on the other side of the borders. Wrong. Because what happens on the other side of the border will force itself on you, whether you like it or not. So the second thing that we discovered in this, in addition to this problem of rising nationalism versus internationalism, is that we lack in all our countries proper crisis management programs and mechanisms. We should have from the day one in every country, and I don't blame the US or any particular country, I say every country should have, since day one, should have set up a crisis management program and a crisis management team. Another failure is in the research and development investment field. When companies are investing billions in inventing medicines and various innovations, why haven't they provided any resources for investing in research for possible and future epidemics? It is not difficult to imagine, after having the world has gone into so many global epidemic crises, that we need to direct some resources to investment in the prevention of future epidemics. Another problem was a unified image of public awareness. Politicians, as we have seen particularly in the US, with different and conflicting views and in contradiction to views expressed by the WHO and by their own scientists, was confusing and led to culminating this crisis. Citizens deserve having one directive issued and implemented and respected by everybody, so that they know what they have to do. One major conflict, in addition to these problems and handicaps, was the confusion between what is more important, life or economic prosperity. There were arguments and counter arguments about saving lives regardless of what happens to the economy. And there were voices of wisdom which said, yes, saving lives is our priority, but saving our future economy is our priority too, like Xi Jinping did in the very first days of his fight against Corona. He said, I will not allow this epidemic to destroy our economy and the future of our country. So we did not know what balance and how to balance the two directives and two interests. Where are we now? We are in the middle of the crisis. And I would like to say, as a student and reader of expert views, that we need to realize that we are going to be in this for 4 years. Politicians can say what they like because it serves their political goals. Companies, pharmaceutical companies, can say what they like because it serves their business, and so on. But the real facts are that this kind of epidemic is of the nature that you cannot contain it in one country and leave another country out. So you will need a massive global coordinated effort, even after you invent the vaccine. If you invent the vaccine, it will have to go through processes of testing and making sure that it doesn't have reverse effects or counter effects. You need also to make sure that it really treats and for what duration, or prevents for what duration. It's a long testing process. And again, I say the politicians, economists, everybody can say what he likes. I'm presenting my personal view because as Aristotle used to say, I love Socrates, but I love truth more. Now, in order to achieve the point where you have vaccinated or vaccinated every individual in the globe at the same time, which is an impossible task. It is very difficult because some people will even resist. Some people will not be able to buy. Some countries will not be able to agree, etc. Because if you leave individuals, after you do the vaccine, you do vaccinate or apply the vaccine to a large number of the population of the country, unless all your neighbors, and your neighbors are the globe, because every neighbor has a neighbor, and every neighbor will transmit again the epidemic to the neighbor. So we have to realize that this is not as easy as we are told by the media. Also, we have learned that the authoritarian method or model in China works. So we, in spite of our love for democracy, we have to accept that in certain cases, for the sake of our lives and prospects, we need to be authoritarian, and we need to impose the rules for fighting this epidemic by force of law and by implementing orders, political, legal, and military force. You cannot leave this democratic choice to anybody whether to put on the mask or not. This should be considered a violation of the law and is subject to all the action taken when anybody violates any law. Having said this, I also want to tell you that you have to realize that not everybody was a loser in this crisis, because I've always said that a crisis is an opportunity. Bill Gates himself said that the IT industry gained at least 13%, and that was several months ago, growth as a result of the epidemic. The pharmaceutical industry, the industry for all the needs for this crisis, including ventilators, masks, etc., medical supplies, they made a lot of money too, and there was an opportunity for them in this. So try also, while you are facing this crisis, to realize how you can turn this crisis into an opportunity. Now, in order to summarize, I would like to say we need to stop blaming COVID for its being with us. It doesn't help to start and keep talking about how unfortunate, how bad, how. So this dialogue and this discussion is counterproductive. What we need to do is, as you mentioned, is how to conquer it by outliving it, by surviving against it. And you can. It is possible. Therefore, I believe that our focus should not be waiting, not to wait for the solutions to come, whether it's vaccine or medical treatment. What he should do without any delay is how to be a winner in this fight by taking the proper precautions, by using and benefiting from the advice by the medical industry, and by coming up with solutions that will counter the damages resulting from this crisis. Therefore, also, we need to form crisis management task forces in every country. You cannot leave it to the Ministry of Health. You cannot leave it to the medical industry. You cannot leave it to the politicians. You cannot leave it to WHO. Every country should have its own crisis management team dedicated for fighting this epidemic in every way that you've run a campaign. And this team should include definitely medical experts, scientists, government representatives, and as well as economists and businessmen and civil society. It should be a multidisciplinary team of all stakeholders who can study, analyze, decide, and teach, as you said in your introduction. And I call it awareness. Public awareness was one of our greatest weaknesses in this crisis. We didn't know where to go. Do I go to WHO website, or to the ministry, or to the department for epidemics? That should not be the case. There should be one source for in educating and instructing what has to be done. That is a need in every country, but that's not enough. A global crisis management team managed by WHO, whether we like that organization or not, it's the organization, the global organization, that can only sponsor, it's the only one that can sponsor a worldwide planning and implementation campaign to fight this epidemic. And perhaps your important organization, NAMA, can present a proposal to WHO. You are the experts. I am the citizen. Perhaps you could develop a proposal asking that the WHO, because we have still many years to fight. It's not yet over. It's not going to be over by this end of December, not by the end of the year after. It is a very difficult process to terminate this epidemic. And therefore, what we need is to have a global crisis management task force led by the WHO that would be given the authority and the responsibility to implement coordinated plans, because I repeat humbly, and as Winston Churchill once said, the greatest lesson in life is to realize that idiots are sometimes right. Take me for an idiot, but I can be right. Consider at least what I'm saying and test it with the time and wait and pay the price for waiting to take advantage of any advice. So perhaps you could lead this important initiative under the umbrella of the WHO, because if it is not a global exercise, you will not get rid of COVID. You can think forever that you will close your borders and let the rest of the world die and think that you will survive. And I'll tell you, unfortunately or fortunately, it doesn't work. Because unless you address this crisis with the understanding that the health of every, or the survival against COVID of every human being in the world means your survival as well. Because he can be the person from any African country, South American, Asian, European, or anywhere that will transmit this epidemic to you. Only a global initiative under a recognized global organization can address this issue. If a country doesn't have the money to buy the vaccines, and this will not be over until you can, it is helpful to produce medicaments and treatments, etc. But unless you come to a tested, approved, useful, non-destructive medicine, vaccine, and you are able to give it to every human being in the world, 6 billion people, all of them, whether they can afford it or not, and whether they like it or not, there will not be an end to this epidemic. I say this, and I leave this thought with you, and your great organization, I think, has the responsibility at least to study this proposal from this idiot that's talking to you, and to do whatever you think about it or with it in order to save America and to save the Arab world and all the world. In this, we are all in, and we will not be out except together. Thank you very much.